Hi, this is Dr. Jack Ringer here in Anaheim Hills with another episode of What Would You Do, Doc? So, have any of you ever gone to the dentist and they said, you're grinding your teeth, or you look in the mirror and your teeth seem a little bit shorter? That happens to lots of people. And the question is what would you do? Why do anything? What's the problem? What's the cause? Everybody's teeth never touch except for one thing that they do during the day, normally, and that's when they swallow. And people swallow about 2,000 times a day. But any other time your teeth touch, we call it parafunction. It's something that's a little abnormal. If that weren't the case, if you're touching your teeth or rubbing your teeth together, or bruxing, we call it, happened all the time, people would wear their teeth away to nothing. But people do develop habits, and they clench or they grind their teeth. It used to be thought that this was something that primarily happens at night. But the data now is showing that people grind or brux more during the day. So, what do we do? Why do anything? Well, teeth don't heal. That's why I have a job. They're not going to grow back. Now, we do have appliances, and a lot of people call it a night guard because historically you just wore it at night. An appliance like that is very valuable. And you may want to wear it when you know you're under stress, or you know you're clenching or grinding. Maybe when you sit in front of a computer. Maybe those long drives on the freeway, you get frustrated and you clench and you grind. There are other biofeedback techniques you can do. If you have something in your mouth, like a piece of gum or a Tic Tac, you're not going to connect your teeth together. So you may want, while you are, again, driving or sitting on front of your computer, chew a piece of gum. Okay? It'll eliminate that possibility of grinding on your teeth. Now, restoring the teeth back to their normal shape and form, well, that's a whole nother story as to what would you do. Beauty in the mouth is length and brightness. That depicts youth. And we can give you back that. We can take off years off of a patient by building back what they drilled off, not your dentist in a sense, and at the same time maybe eliminate the discolorations that have absorbed in the tooth, okay? So we started off, what would you do with worn, yellow, broken down teeth? Well, go to your dentist, have a really comprehensive evaluation, figure out why it's happening, what your options are, because there are many. There's only one diagnosis, your teeth are worn, but there could be lots of fixes, okay? But you have to decide based on all the risks and benefits of these different procedures and what your expectations are to get the result that you want. So for that beautiful smile that you always want and deserve, you can reach me at 714-974-0313, and always you can reach us on our website, www.dentalcosmetics.com. Thanks for listening, and I look forward to another episode on What Would You Do, Doc?